Look at that PIP. It's 65. Normal is 25 to 30 in a patient. It's very likely we have significant danger of a pneumothorax in this patient as well. Looking at his scalars, we can see that the auto PEEP is 8, which means we could have a high PEEP alarm as well in this patient. Plateau is only 25, so anything less than 30 is good, so we're good in that area. It's important to remember that the difference between peak inspiratory pressure and PEEP is airway resistance. So in this particular case, does this guy have high airway resistance? Absolutely, he's an asthmatic. That's typically very much what we see in our asthmatic patients. So to get this patient better and fix this alarm from going off, we may want to flip the patient to pressure ventilation as opposed to volume ventilation, which he is in now. This would minimize the chance of pneumothorax in this patient. Also, adding a little bit of PEEP to this patient may not be a bad idea to help stent open the airways. Back in the day, we used to never give PEEP to patients with asthma, but now that we know that this can really help correct the auto PEEP that these patients automatically have when they come in ventilated in an acute respiratory distress. So some of our take-home points for today, as we've said over and over again, always look at your patient first. See what's going on with your patient to visualize what might be causing those alarms and take care of what you can. Don't fall victim to alarm fatigue. Know what your ventilator is capable of, what the different sounds are, why it might be alarming. Know the established protocols in your facility. When should you call the respiratory therapist? When is it okay for you to make changes on the ventilator on your own? And when do you need to call a provider to the bedside to help make these changes? When you get report off, always check your vent first. Just like I know a lot of us nurses do, we go in and run our lines with all our IVs and everything. You need to go in and run your vent circuit too. Make sure that the settings that the vent is on are the same as